Hello, good afternoon, everyone. This is Riyad Karim. I'm the Interim Head of Primary Care Commissioning at North Central London CCG Enfield Directorate. It's a real pleasure for us to welcome you today to the Enfield Community webinar on COVID-19 vaccines. We will be starting right now. We've got a lot to go through, and we're really keen to speak to you all and have this session with yourselves. Thanks for your time. So in terms of some brief housekeeping, obviously with this session we'll be running between 1 and 3. It's going to be kind of packed with lots of items. Attendees have their microphones muted and their videos off. This will provide the best audio quality from the speakers. If you've got any questions, please use the Q&A option on the screen, and our colleagues Katie and Dudu in Public Health, Enfield Council, will be reviewing the questions, and they will be answering some questions in real time, and others will be kind of held back for the Q&A after the presentations. We may not be able to answer all your questions depending on the volume, but we'll certainly do our level best. The information pack will be sent out after the event, but please don't give your email address in the Q&A chat. If you could email myself, riyad.karim@nhs.net, to receive the pack, that would be really helpful. And my colleague Louisa will be prompting speakers when they have a 1 minute remaining on their presentations. Thank you. Right, so just wanted to introduce the context, and thanks for all for attending. So in terms of Enfield, COVID vaccination program is going extremely well. General practice, community pharmacy and mass vaccination sites are delivering. 80% in Enfield people amongst age 70 plus, which is great coverage, and including the over 80s. And I'd like to thank in particular the Herculean efforts of the 3 PCN GP sites in Enfield for their rapid and effective mobilization since mid-December. Communities are coming forward to get vaccinated when it's their turn, and we're keen for all the stakeholders in Enfield for this momentum to continue. We recognize concerns need to be addressed, and we need to provide reassurance on safety and efficacy. And this is a key event, along with many other events to follow, that will provide community events to follow, that will provide information to help you make a decision when it's your turn, to help also address any concerns that you may have. And there, as I said, there will be some follow-up events by the council. So over the summer, there's been, the Enfield stakeholders have been quite concerned about the disproportionate impact of COVID-19 on BAME communities, Black, Asian, minority ethnic communities. Yep, and there's also been impacts of key PHE reports and disparities and beyond the data. And we've also got, we decided to reset the care partnership, the integrated care partnership in the ICP. And that includes the VCSE sector, the Acute Community Provider Trust, the Federation of PCNs and the Council, and the Borough Directorate of the CCG. We're committed to invest in community participatory research, to get involved in community development intervention in Enfield, and we have work streams in childhood obesity and screening and vaccination. And that's why it's really important today for us to discuss about health inequalities and COVID vaccination. And it's really a great pleasure that we have Professor Kevin Fenton, and then followed by Dr. Bola Owolabi from NHS England. Next slide, please. So we literally have got an array of expertise and talent brought in for the doorstep of Enfield to help you make that decision today. And we will go through that order in terms of Professor Fenton, and Dr. Bola and Habib and Kari Asim, and regional speakers and our local GP experts on the ground. I really hope that you enjoyed the session today. Next slide. And with great pleasure, I'd like to introduce you to Professor Kevin Fenton, who's the Regional Director for Public Health in NHS London, Regional Director for Public Health England in London, and he's worked in a variety of public health roles across the government, and most notably, he led the disparity reports over the summer, where the notion of the disproportionate impact of BAME communities became very much in vogue. But Kevin, thank you again for your time and coming in today. I'll hand over to Kevin.
Lovely, Riyad. Thank you so much, and good afternoon, everyone. It really is a pleasure to be here with you all today and having these conversations about COVID, about the pandemic and the impact that it's had on our communities, but most importantly, about the vaccine and why the vaccine is such an exciting development in our fight against this disease. So in the next slide, I wanted to just remind us of the journey that we have been on over the past year. And this slide just shows the numbers of people who've died following a first positive test of COVID within 28 days of that first positive test. And we all remember the first wave of the pandemic in the spring of last year when we didn't know much about COVID, we didn't have many tools, and we were dealing with the sort of acute phase of the infection. And Londoners did really well in helping to stay home in the first lockdown, control the virus, and we had relatively low levels of the virus throughout the summer. But again, we were hard hit by the second wave, and you can see that cases again escalated in terms of deaths, but thankfully they're now beginning to decline. So over the past year, if you go to the next slide, we see that the pandemic has had if you could go back to the animation, please. Yeah, thank you. A tremendous impact on London. We've had more than 680,000 cases across the city, more than 15,800 of our fellow Londoners, or family members, or friends, or colleagues have actually died from this disease. And we now estimate that nearly 44% of all Londoners have been exposed to this virus. It's had a huge impact on our city. And within that, we know that Black, Asian, and minority ethnic communities and boroughs such as Barking and Dagenham, Enfield, Ealing, Croydon, Redbridge have been disproportionately affected both by high rates of disease, but how it's affected our local communities as well. So the conversation today is, how do we get beyond this pandemic, and how do we continue to reduce the harm that this disease is causing on our communities, and how do we ensure that we're using all of the tools we have in the toolkit to help to prevent this infection. So the next slide just tells us what we've learned over the last year in terms of all of the things that we can do to really prevent and control COVID, starting from the 12 o'clock position, from hand washing to wearing your facial masks, to ensuring that you're ventilating closed spaces, to get tested if you have symptoms. Clearly, we're in a national lockdown at the moment, using the sort of personal protective equipment that are necessary, and testing, isolation, and quarantine. All of these things we've learned over the last year as we've gone through these waves on how we best control the infection. But the next slide just highlights what's new to this prevention toolbox. We now have a vaccine. And I've been a doctor for more than 3 decades, 30 years. And this is the first time that I have seen this global focus and effort and resourcing put towards a vaccine that has resulted in the development and now delivery of a vaccine within a year of identifying this infectious diseases and naming this infectious diseases. This is a huge accomplishment for us globally. And now that we have the vaccine available, it's really important for us to begin to say, well, how does this fit in what we're trying to do to end the epidemic? And why should we be having the vaccine? So the next slide just highlights what I think are some of the real reasons why the vaccine is such an important tool for us now. Number one, the virus is here to stay. Similar to the flu, we're likely to have different strains, different variants. So we need to ensure that we're protected against this virus both today as well as in the future. We know that COVID has had a severe impact on minority communities, Black, Asian, minority ethnic communities, and in the second wave, Public Health England released data only 2 weeks ago, saying that in the second wave between December, January, and February, or South Asian communities in London, especially Bangladeshi and Pakistani communities, but in addition to Black, African, and Black Caribbean communities, had higher rates of deaths than whites. And that continues to be a real challenge moving forward. Now, vaccines are much safer than getting COVID, and especially we know because COVID severity increases with age, it increases with deprivation, it also increases with factors, some of the social factors which can make people either at high risk of acquiring the infection or having severe disease. But vaccines are way safer than having infection. So I would much rather have my parents and much rather be vaccinated than to develop the infection. As you hear from the speakers today, it's highly effective in preventing severe disease, and that's what we're trying to prevent here. And that's why the government has been implementing the vaccination program from the most vulnerable senior citizens and moving down the age cohorts. And we now have really good evidence which is emerging that not only is the vaccine protective to yourself, but it is going to be protective as well in terms of reducing the likelihood of reducing transmission to others. There are going to be other community benefits. When we look at the flu vaccine or the HPV vaccine, all the other vaccines which we're now used to using, vaccines not only benefit the person who receives it, but there are community benefits which are important as well. And because our communities have been so hard hit by this pandemic, I want to ensure that we are not left behind now that this vaccine is available. So I am really keen for all of us to get informed, to make that informed decision about why the vaccine is important. And of course, a key part of this is the privilege that we have in the UK of having these vaccines. Many countries around the world do not yet have the vaccines, and many countries are still grappling with the epidemic. So it's important that as the opportunities become available, we take advantage of it here, but very quickly begin to think about how we support other countries to ensure that equitable access to the vaccine will be important. So despite these benefits of the vaccine, we know that there are real issues of people who may be a little bit reluctant about taking the vaccine at this time. And in the last few minutes, I just want to reflect on why hesitancy or concerns about the vaccine is both natural, but it does not need to be a permanent state. And in fact, what we have now learned is that for many communities that were initially hesitant in London about the vaccine, they're getting on board because they're seeing more and more people getting the vaccine. More than 1.6 million Londoners have now been vaccinated. So our friends, our colleagues, our co-workers are being vaccinated, and they're seeing that the harms and side effects are minimal, but also the confidence that people feel when they've had the vaccine just really ensures that people feel a lot better about navigating the pandemic.
You have 1 minute left.
Great. So the next slide just highlights some of the key factors which we have to take in mind when we think about the factors which influence why people have a vaccine. We have to be honest about the historic, political, some of the social-cultural issues that prevent people being motivated to take up the vaccine. The myths and misinformation which are circulating currently, especially on WhatsApp and social media, we need to address those. We need to make access to the vaccine easier, especially for those who may not be registered to a GP, people who may not be documented, or people who may not be engaged with health services. We need to engage them as well. And that's why the program that we're having in London now is about mobilizing, is about having honest and authentic conversations with community members across the city to hear about those concerns, to engage and to answer those concerns, and to ensure that together we're making every and full use of this exciting new tool that we have to end this pandemic. So with that, thank you so much. Great to be here. Wanted to share with you where we are with the epidemic, talk about vaccines, and why dealing with hesitancy is so important at this time. Thank you.
Thank you very much, Professor Kevin Fenton, for that very comprehensive presentation, and definitely sets the challenge and the scope of what we need to do next. Just checking in if we have our next speaker on. I noticed he's having a little bit of difficulties getting on. Bola, are you there? I think what we'll do is we'll move to the next. Professor Fenton, was there anything that you wanted to add further to your presentation in terms of the next steps of what we need to do in Enfield and in London?
Sure. There's a slide number 12, if you wanted to just click on that, because that gives a sense and a framework. Thank you, Riyadh, of what we can do together to stimulate some of these honest and authentic conversations that we're having around London. And one of the things I've been really impressed with, Riyadh, is that, these conversations about vaccines are being held in GP practices, in community centers, in schools, in churches, in mosques, all across the city, as we talk about the vaccines and as we support people to make an informed decision and choice. But at the London level, we're doing some really exciting work to pull these conversations together on a vaccine. Because number one, we want to ensure that we have a community-centered approach to what we're doing so that we're listening to communities, hearing concerns and responding to them. We want to ensure that the national campaigns which are developed by the Department of Health are really landing well in London. And thirdly, we want to build upon all the fantastic work that you're doing. So conversations such as this in Enfield, others which are happening across the city. We share resources, share the conversation, share our findings, so we can ensure that we have the tools to get delivered to our communities. So in this slide, we just talk about better coordination, better data, really working with our partnerships, really using our resources effectively, so that London has one big conversation about the promise of these vaccines. And as a city, as a global city, we work together to address both hesitancy, but motivate people to get engaged. Thanks, Rian.
Thank you very much. Thank you. Thank you, Professor Fenton, for your time. And it's really, really important to underscore the efforts that we need to do together collectively to make sure that we get the protection for the people when it's their time to get vaccinated. Thank you again. So what we'll do is we'll move to our next speaker following Bola. We'll try to bring Bola back in when she can get back in. So we'll just move to if you just bear with us. Thank you very much. As you can imagine, this is a live broadcast, so there may be some hiccups around the way, but we'll do the best to kind of iron them out. So I'd really like to welcome also Dr. Habib Naqvi. He's the director of the NHS Race and Health Observatory, and he has a background in public health, health psychology, health policy, and strategy and development, and he's worked a number of years at NHS England, where he led on national equality and diversity. So real pleasure to introduce you to Dr. Habib Naqvi. Thank you for coming to Enfield, and grateful for your thoughts and your insights. Thank you.
Great, thank you very much, Riyad, and thank you also, Professor Fenton, who is one of the board members of the NHS Race and Health Observatory. My talk will focus upon placing this challenge that we have around COVID-19 and the vaccine within the context of ethnic health inequalities, and in relation to what we are doing within the NHS Race and Health Observatory. Now, we know in terms of ethnic health inequalities that these exist and span from neonatal health to end-of-life care, and in many kind of sections in terms of the milestones in between those two points. And what we've seen over the last 12 months is, I guess, yet another example of a very clear light being shown on the ethnic disparities that we see within wider society, reflected with a pandemic and COVID-19. So there is a level of urgency, and as I always say, our country and this healthcare system that we work in should be well prepared for that level of urgency, because we've always had a long history of migration within this country and well-established Black, Asian and minority ethnic communities, and always had high levels of investment in health research. And the example of the Oxford vaccine is just one kind of example of the health research and innovation that we have within our own country. And the fact also at the same time is that approaches to tackle ethnic health inequalities in general haven't always really kind of hit the nail on the head, or been as focused on meeting the causes of the deep-seated, deep-rooted issues that we often talk about within society. And so one of the reasons for establishing the NHS Race and Health Observatory has been to focus on those deep-rooted issues, so that we're not just focusing, we're just not playing around the edges and focusing on the surface level issues, but the deep-seated issues. This slide kind of highlights exactly our approach to not just health inequalities in general, but our immediate response to the COVID-19 issue, which we are looking at in three parts. Firstly, synthesizing the evidence, looking at the data, the rapid reviews, turning that into actionable recommendations for change, and I'll come on to that with a infographic that we issued last week. And then thirdly, supporting and enabling the healthcare system to implement those recommendations on the ground. Now, where we are with the virus, as Professor Fenton has highlighted, is, I guess, of that very kind of sad reality of over 115,000 now hospital deaths from COVID since the start of the pandemic. And although we cannot escape that reality, what we can do is learn lessons from the previous waves of the pandemic and draw insight, I guess, from the evidence of the virus and of how the virus is impacting upon ethnic health inequalities and our diverse communities. And as we've seen over the last 12 months as well, there have been several official reports published on COVID-19 and its impact upon ethnic minority communities, including the excellent report from Professor Fenton. And what we now need to do is to draw learning from that and better plan our approach with clear action to prioritize and to protect the most vulnerable within our society. So there is obviously a clear risk that there may be some level of hesitancy with regards to vaccine uptake amongst our minority ethnic groups. But what we really do need to do is understand the causes of that hesitancy and address those barriers head on. So we are also aware, which is kind of the irony in this, is that the most at risk, or some of the most at risk from COVID-19, are also amongst those that are more likely to be vaccine hesitant. And that doesn't just include our communities, but also our Black and minority ethnic NHS and social care frontline staff as well. And so, as Professor Fenton said, we really need to focus on the accurate information, move away from that fake news that's doing the rounds, and make sure that we can focus on that huge effort that we are focusing on at the moment, involving community leaders, and we listen to faith leaders as well during this webinar, which is absolutely fantastic, in a way in which we can absolutely endorse, support, and focus and amplify the accurate information that we have with regards to the vaccine.
You have 1 minute left.
My next slide shows the infographic that we issued last week, built upon some excellent work that a small group that came together, including Professor Fenton, inputted into, focusing on the things that leaders within healthcare and community settings can do to increase the level of trust and confidence in the vaccine amongst our diverse groups. Building upon that trust, and Professor Fenton highlighted an excellent equation to us in a webinar last week, which is trust is built upon truth and consistency of that truth over a given period of time. And that's the foundation of this infographic, is looking at making clear, repeated measures, messages, embedding that within the community, using professionals and community leaders to give out that message, and to base our focus on data and real, clear and crisp communications on this agenda. The message is very clear in what we put forward. The vaccine is safe, it's been tested, it's been tried, and it will save lives. And I'll probably pause there, Riyadh, and hand back to you.
Thank you very much, Habib. That's really informative, and that's a really impressive and visually impactful infographic as well. That is very thought-provoking, actually, but it kind of underpins the the approach that needs to be taken. So that's really helpful. So Habib, I'd just like to say thank you very much. We're just trying to get Bola into the meeting. But I think we're still having a few teething issues on that. So what I will do is we'll press on to the next speaker. Thank you very much. And in the meantime, my colleague Anthony will try to bring Bola in. Thank you very much. And I'm delighted to introduce you all to Imam Qari Asim, who's the Chair of Mosques and Imams National Advisory Board and also Legal Director for DLA Piper. Qari Asim has been very high profile with regards to the importance of COVID-19 vaccination, and he's going to offer us a perspective from a faith community perspective about the challenge ahead and what himself and other faith leaders have been doing in this particular space. So that's really helpful. So Imam Qari Asim, thank you, and a real pleasure and a warm Enfield welcome to you this afternoon. Thank you.
Thank you, Riyadh. Really grateful to Enfield Integrated Care Partnership for bringing us together here to share our views. And today I'm going to be talking about COVID vaccine from religious perspective. My colleagues, Professor Fenton and Dr. Naqvi, have already spoken about how COVID-19, while we have all faced the same storm, we are not in the same boat. And Black and Asian minority ethnic groups have been disproportionately affected. So I guess from religious perspective, I'm moving on to my third slide, which is about vaccine being a gift from God, delivered by human endeavor. And Islamic tradition is very clear on that believing that effectively God did not send down any disease, but that he also sent its cure. So from our perspective, it's very much about vaccine being a cure from God that we need to adopt. But it's quite natural to have questions, concerns, and effectively, this is what we've been dealing with in our work at MINAB, Mosques and Imams National Advisory Board. There's some religious concerns, and so in one of my slides 6, we talk about the religious concerns, firstly, whether or not the vaccine is safe. And scholars in the UK as well as abroad have consulted health professionals, micro nanochip experts, and everyone else to confirm that the vaccines that are being used in the UK, they are permissible under Islamic law. They do not contain any aborted fetal cells or animal protein or alcohol, and as a result, they are permissible from Islamic perspective. They are halal. And even if they did contain a negligible amount of these substances, there's a valid position that if an unlawful substance undergoes a significant change in its chemical nature or physical properties, then it becomes permissible. So effectively, there should be no hesitation from religious perspective to take the vaccines that are being administered in the UK. Then I guess in my next slide, I address another religious concern that we have, which is whether or not we can take the vaccine during the month of Ramadan when Muslims are fasting. Again, MINAB has issued guidelines to say that it's permissible from Islamic perspective to have a vaccine whilst in a state of fasting. Injections that are done to administer vaccination or medicine into the body, whether through the veins or through the muscles, do not break the fast, and therefore people should be absolutely fine in taking the vaccine whilst fasting in the month of Ramadan. Then moving on to the next slide, where we have come across some of the concerns whilst holding webinars that MINAB has held around the country, and some of those concerns you would have already heard in terms of they are wide and varied and also intergenerational. So from our experience, when speaking to the elderly members of the BAME communities, they're more concerned about side effects, whereas when you speak to perhaps the younger members of the community, they're more concerned about, they're more into 5G radiation types. And also this huge level of mistrust as well. So a combination of vulnerability and distrust of those in authority manifests itself in defensiveness. But what we have learned is through holding the webinars and also talking to people, so alleviating their concerns rather than dismissing them, the tide is turning. So when I'm speaking to family members and mediating between them, for instance, just to highlight, we had a particular scenario where the father had been lost to COVID-19, sadly. Elderly mother wanted the jab, but one of her children was not into, was believing into these anti-vaccine campaigns, and as a result, he was dissuading her from taking the vaccine. So when we went into the family situation, talked to them, within a few minutes, actually the whole family was convinced. So it's really important that we keep open those channels of communication. Another approach that Minard has taken is actually tackling the misinformation as well as highlighting the factual information through Friday sermons, and that's slide number 11, where we talk about where we address some of the concerns through scriptures. So effectively saying that the Quran says if you save one life, it is like you save the whole of humanity. So really highlighting what Professor Fenton was talking about earlier, in terms of it's not just protecting your own self, but also protecting family members and the community members as a whole. Then the next slide talks about, it's really important that the trusted voices are used in this instance. So when we ran a campaign where imams were taking photos and sharing those photos whilst being vaccinated to reassure communities, to inspire confidence in them. And here we have obviously Archbishop of Canterbury as well as Sheikh bin Baer, one of the leading imams in the world. And one thing is clear: the messenger is as important as the message in this campaign. And finally, in my last slide, I just wanted to highlight that how can we recognize and resource some of those community voices? Outreach, engagement, and accessibility is really important to reach the marginalized communities and inspire confidence in them. And this could be due to changing the environment in terms of overcoming the cultural and language barriers, as well as empowering those communities through the work that's being done by our local surgeries, GPs, and the community partnerships. So thank you.
I'll mute myself. Sorry. Thank you very much, Kari Arsen. That's really, really, really helpful, and a lot of contribution there from the faith community's perspective. So, ladies and gentlemen in the audience, we've had lots of presentations thus far. Feel free to add any questions to the Q&A section, and we will deal with that after the presentations. Thank you again, Kari Arsen, for your time, and I'm glad that you'll be joining our panel later on. I'm very glad to now introduce to you Dr. Bola Owolabi, who's GP in Worksop and also Director of Health Inequalities at NHS England and NHS Improvement. She has particular interest in reducing health inequalities through integrated care models, and it's a real pleasure for us to kind of welcome her to Enfield. Thank you, Bola, for coming on board today.
Thank you so much for having me. Can you hear me?
Perfect.
Hello?
Thank you.
Are you able to hear me? All right,
Thank
you. Great to be here. Thank you so much for the invitation. And I recognize that we are here today in the context of the pandemic, and certainly efforts to drive up the COVID vaccination uptake amongst our communities, just to make sure that we get to a place where we see a reduction in people becoming dreadfully ill and indeed being admitted, and sadly, some people even losing their lives as a result. I'm here today really to talk to you about the work that we are doing in NHS England and improvement more broadly in relation to health inequalities, not specifically in terms of the pandemic or indeed the vaccines. So it's my 7th week. I started in this role on the 4th of January, and I just wanted to share with you what we're seeking to achieve and what we're trying to get to. Thank you. Next slide, please. So our vision is to get to a place where we achieve three things. And we're talking about access, experience, and outcomes. And the reason why we're pulling this out is because quite often we focus on access, which is very important. But a lot of people will recognize that once you cross the threshold, it's also important to think about the experience of care that people have, because that has a direct impact on the outcomes or not that they achieve, and also in terms of their health-seeking behavior in future is significantly impacted by their experience of care. And I will tell a really quick story here to bring to life what I mean. So I remember being in labor 18 years ago, expecting my first child. I had no problems accessing the maternity services, but I did have a problem being forgotten in the side room for 7 hours in labor without any pain relief. And lots of people in the audience will recognize that, you know, the outcome could have been very different for myself and my child. And so from my point of view, and certainly the team that I'm working with, we want to ensure that there is indeed equity across those domains of access, experience, and optimal outcomes for people going forward. Next slide, please. And so the approach we want to take is to be very deliberate about taking a quality improvement approach. And I'll explain what I mean. There has been a lot of research into health inequalities. We have a lot of analysis. We have a lot of evidence synthesis. There is very clear description of the problem. Sometimes the difficulty is translating all of that into tangible actions on the ground, you know, looking at what actually works. And so that's why, as a team, we are looking to take in a quality improvement approach so that we can translate all of that body of evidence into tangible actions in communities like this one in order to begin to move the dial on health inequalities in the right direction. And we're looking at three key quality improvement approaches. The first one is in relation to data. We want to get to a place where people don't just see data as an end in itself, but for the data to begin to generate actionable insights that people can then use to take forward interventions that actually make an impact in people's lives. The second methodology, appreciative inquiry, that really is a methodology which asks the question, what is strong rather than what is wrong? Because in every community, something works. There are things that people are proud of. There are things that people do well. And the whole point of appreciative inquiry is to change the questions we're asking people so that we can actually work out what is it that works in a particular community and then build from strength. And the final methodology is around co-production. I know that communities often have the best answers. So when I took on a GP practice where I still work 5 years ago at Cresswell near Worksop, we couldn't recruit any GPs and we struggled to recruit other types of healthcare professionals. And I'll always be grateful to the patient participation group. They came up with most of the ideas that we eventually took forward, whether that is in terms of employing a clinical pharmacist, taking on emergency nurse practitioners, and getting to the practice, you know, getting the practice to a place where it was easier to recruit because we were doing things differently. And a lot of that came from the patient participation group, not from us GPs. And that's why co-production is such a powerful thing. And we've seen it even in the context of the pandemic and the vaccination rollout. A lot of examples, you know, as you've just been hearing there about, you know, vaccination sites being set up within places of worship, faith leaders, including communications about the vaccination within their sermons and all of that. That has come from the community. That's not something
1 minute left.
that has been mandated from the center. And just final slide, please. And so, and I will just skip this slide as well. I've talked through what we're trying to do. So essentially, we're looking at these communities, the ethnic minority communities, people living in deprivation, inclusion health, i.e. homeless communities and traveler communities, and people living with disabilities. These are the communities that we are going to be working incredibly hard to ensure that we do ensure equitable access for them, to give them excellent experience of the care we provide, and to make sure that they do have optimal outcomes through the ways that we work. So thank you so much for having me today, and really looking forward to learning more from you in terms of how we can work from an NHS England and improvement point of view, taking all the learning that we've already seen coming through the pandemic and the vaccine rollout to the broader agenda of reducing the health inequalities gap that we see in our communities. Thank you so much.
Well, thank you very much for another comprehensive sweep through health inequalities and how important that is, and the importance of reducing health inequalities. That context is so important and is really reassuring to go through the methodology that you did. So thank you very much, and I'm sure there'll be questions about this in the Q&A. Thank you, Bola. So I'd like to now hand over to Marcus Riddell. Marcus is the Head of Equality and Inclusion, Evidence and Policy, Staff Vaccinations at NHS England Improvement. He's led a series of efforts to support staff-related efforts to support staff related to the pandemic, and it's a real pleasure to bring Marcus, who's also an Enfield resident, Enfield lad, if I could say that, but it's really helpful for Marcus to be here today and to take time in the diary to discuss this important issue. So Marcus, we won't be sharing your screen, you'll be on stereo color, but thank you very much for your time, and really looking forward to listening to what you have to say.
Yeah, thanks Riyadh, thanks very much for the invite, and yeah, really happy to be here. So as Riyadh laid out, I'm the Head of Equality and Inclusion Policy for NHS England, which is very much workforce facing, and I lead on staff vaccinations specifically for secondary care, although working very closely with primary care colleagues and social care colleagues as well. I am from Enfield, so yeah, an Enfield lad's probably an accurate way of putting it, Riyadh. In fact, I was going to the Evergreen surgery when it was on Church Street, and the doctor was, the GP was Dr. Bodger. So this is probably older than I look, it's going back some time. And I went to Latimer All Saints, went to Enfield Grammar School. I used to live near Pimms Park, and I live in the north of Enfield, north of Enfield town. I played rugby here. So we've been here a long time. In fact, my dad's side of the family came to Enfield as part of the Windrush generation, and many of them are still here. So very happy to be here on both a professional and personal level. What I'll do is briefly summarise what NHS England is trying to do for staff in terms of the vaccination programme, and then I'll talk about what's relevant for Enfield in particular as a kind of a bridge to the next section of the webinar, where we get into what's happening in regions both in the south of the country and across the country. So our objectives are essentially twofold for health and care staff. We want everyone to be able to make an informed decision about the vaccination in the way that we're doing here for the wider community, and we also want to ensure parity in uptake. Now, Professor Fenton's presentation laid out why that's particularly important here. And of course, we've got a lot of health and care staff in the borough. We've got lots of social care homes, adult social care homes, many GP surgeries, 2 NHS trusts, and of course, North Middlesex has, well, formerly had the highest rate of ethnic minority members of staff, although there's a few London trusts that are kind of in the argument for that accolade. And it's well documented by the nature of health and care workers' jobs that they're at high risk from COVID, just by nature of the work. And with the high number of minority workers in Enfield, you know, unfortunately, we have kind of borne the brunt, I guess, of what's happened so far with the pandemic, and that was partly why health and care workers were pushed up the prioritisation list for vaccinations. All of this talk from me about staff is not distinct from communities. Now, what I mean by that is, firstly, for staff that have been impacted by COVID, they of course have families and friends but also staff and the community is one and the same thing. It's almost a kind of it's a distinction we draw, but really we're talking about the same people. And there'll be people, in fact, listening now who be well aware, may even have been in North Middlesex Hospital in January when it once again declared a major incident owing to the amount of seriously critically ill patients from COVID in the hospital. So this is all one and the same. And when you think about where North Middlesex is situated, or where the Evergreen surgery is situated, it all goes back to the issues that Professor Fenton and Dr. Nagby were talking about. So you're talking about areas with high ethnic minority populations, underlying health conditions, higher deprivation, etc. So this is all, as I say, one and the same. So when I talk about staff making an informed choice, it's not necessarily the message of take the vaccine, protect the NHS, saves lives. It's actually, where are they from, where do they work, what's their family history. What we're talking about is more personalised conversations with health and care staff about what their concerns are in order to make them feel that they can come forward. When they stop working, the people on the panel, you stop working, you go home, you don't suddenly become a member of your community. You have your concerns and you carry them to the job, and you leave the job and you still have them. So you need the same conversation that we're offering to, thank you, that we're offering to patients. It's the same conversation. So what I wanted to say in conclusion, essentially, is this. Firstly, let me commend, whilst I've got the chance, the excellent work of health and care staff in the borough in the vaccine rollout. Enfield has motored ahead, and whilst professionally I shouldn't show any bias, I love to see it. I'm very pleased to see it, so I just wanted to say that. And then the second thing I wanted to say is health and care workers are, of course, amongst the most trusted members of our community. And for those that have been vaccinated, or even those that haven't, the fact that they're here today to talk about their experiences, their concerns, is really important. And we have done our best to promote this, and we'll continue to do so in Enfield and London, and indeed the rest of the country. And finally, what you'll hear about in the next session is a bit more about how health and care workers are making efforts to work with the community in the manner that Bola suggested, to essentially join up the wide spectrum of services in your local areas to produce a response to the pandemic, not just about vaccinations, but generally, that's rooted in what the local community wants. So I would argue Enfield's made quite a good effort on that already, but part of this discussion here is to see what else we can do so people feel able and willing to come forward and do not feel forced and compelled to come forward, which is exactly what shouldn't happen with this type of engagement if it's going to be long-lasting and effective. Thanks very much.
Thank you very much, Marcus. Really appreciate that professional and personal perspective that you shared with us today. Thanks for your time, and also a very useful summary and summing up, and a very joined up discussion there in terms of what we've learned thus far from all the speakers, Professor Fenton onwards. So thank you for that. That's great, and look forward to you joining the panel later. Ladies and gentlemen, keep on feeding through to the Q&A. Dudu and Katie are looking at those questions, and we'll hold some questions back for the Q&A session and deal with them at the source as well. So thank you for your patience, and I'm really now delighted to introduce to you Shahana Ramsden, who's the Deputy Director of Workforce Transformation South East Region, NHS England and Improvement, and she's also the co-chair of the South East Turning the Tide Transformation and Oversight Board. And she's had a very long and distinguished career in public sector and education, health and social care. She's currently deployed to NHS England South East Region Vaccination Programme as Director of Vaccination Workforce and the Specialist Vaccine Equalities Advisor. So it's a real pleasure to introduce you to Shahana, who can give us some insights of what's happening in other parts of England that are close to our heart, and particularly over the summer when disparities were surfacing and we were understanding the implications for BAME communities. I was certainly accelerated into my interest in terms of the reports that Professor Fenton had written, and also the activities of the BAME disparity cell, of which Shahana is part of. So it's a real pleasure professionally to kind of bring you to Enfield today as well. Thank you for your time. I appreciate you've got not much time before your board meeting, but thanks and again. So over to you, Shana.
Thank you, Riyadh, and thank you for all the work you've done in pulling this fantastic lineup of speakers together. So if I go into my first slide, something that you may not know about me is that even though I live in Hampshire, I was actually born in Leeds to a Muslim family of 9, and we've all gradually moved to the south of England. And even though there's lots of us now with 9 children all married and 24 grandchildren, my mum, who's pictured in the middle of the slide, she's the matriarch of the family and she's the cook. And we get one phone call from her and she says she's cooking and we have to be there. And there's no chance. If we don't go, we're going to be told off. So I wanted to tell you about the story of my mum, because I think when we were first locked down in March, the hardest thing was not being able to see my mum and the fact that we couldn't have her really warm hugs and her delicious food. And that really did take its toll. Particularly, I'm not a very good cook in my household, so we were relying on my mum. But in April 2022, I was chairing the Turning the Tide board, and we were given some figures about the pandemic. And the data was very concerning, particularly concerning because the data was about people like us. So for Pakistani families like mine, the risk of death from COVID-19 was between 10 and 50% higher risk of death compared to white British. So obviously that caused some concern. And so as soon as the vaccination program arrived, one of my first priorities was to make sure that my mum understood the benefits of the vaccine. Because I guess one of the reasons she was front of the queue for vaccinations was because as a family, we're all desperate to get to a place where we can hug each other and eat my mum's amazing food. Mum had her vaccine, one of the first actually in December, and she fed back that it was a very well-organised place, very clean. Bear in mind, my mum, if she ever comes around your house, she will check to ensure there's no dust. The vaccination centre met all her guidelines for cleanliness, and she said they were very nice and really supportive when she went for a vaccination. She in particular had no side effects, even though she's recovering from cancer, and we were a little bit worried about side effects, but she came away and she had no side effects on this occasion. Also, my son, who's a key worker in a special needs school, had his vaccine 3 weeks ago. So the 2 people closest to me, my mum and my son, have had their vaccinations. And if you can go on to the next slide. So for me, it's a personal mission for me to make sure that in the Southeast region, we do absolutely everything we can to engage our BAME populations and other groups who haven't come forward for vaccines. So if you can see from this slide that in Slough, one of our vaccination centres had a day specifically for women, which encouraged Muslim women to come forward for vaccines, particularly the 80 plus Muslim women and the 75 to 79 age group. We also, in one of our trusts, we had a number of senior BAME staff, including the Chief People Officer, having a video done of their vaccine and making sure that afterwards they went out and they walked the corridors and obviously socially distanced found BAME staff and encouraged them to take up the vaccine. And then we did some work with our faith communities, with the Surrey Ethnic Minority Forum, which engaged over 50 faith communities. And similar to the stories we've already heard, the Imam shared his video about vaccinations and encouraged others to follow his lead. You'll also see we've got this fantastic mobile vaccination bus developed with the Alliance for Better Care, who've proactively engaged communities. And this bus goes to specific targeted areas where we feel there isn't a high enough vaccine take-up, and where people can walk to it very easily and not have the challenges of travelling to a place. And then finally, we've also looked at specific needs of homeless people. So in Portsmouth, 26 homeless people were vaccinated, plus their 6 helping hand volunteers who would not normally have been picked up through our normal routes. So you can see here, there's a hive of fantastic activity in the Southeast region. And I'm just about to go to a board meeting at 2 p.m. where we've brought together all the chief executives in our area. And we've actually asked them to tell us what fantastic work they're doing. We want to hold them to account for addressing this issue, because it's not down to our communities alone to address this. I think often I say that when we're working in a system where we have structural, institutional and interpersonal discrimination, if we do nothing—
You've got 1 minute left.
Thank you. If we do nothing, the outcome is going to be discrimination. So what we're doing in our patch is we're accepting that if we do nothing, that's not good enough. So our chief execs, all one at a time, will be presenting to us about the work that they're doing around vaccine inequalities and what they're doing to make sure we actually address this issue. So I guess in conclusion, what I'm most looking forward to is getting that phone call from my mum when we've all been vaccinated and said, I've cooked for you all and you're going to come, aren't you? And I'll be saying yes, because that's what I'm looking forward to getting my life back to normal. Thanks.
Thank you, Shahana. That's a very heartwarming presentation. I really appreciate you kind of giving that kind of dimension. You're such a senior BAME leader, and to kind of at the end of the day, we're all connected to our families, and COVID vaccine gives us the best chance for us to bring our families together again, and the best defense that we have to protect ourselves from this horrid disease. Thank you so much for your time. I wish you well with your board meeting, and really look forward to ongoing work with yourselves as well, if possible. Thank you, Shahana.
Thank you.
Great stuff. Thank you. Thank you very much. Really appreciate that. Great. So now we're handing over to Dr. Fazana Hussain. Dr. Fazana Hussain is a jobbing GP, also PCN Clinical Director in Newham Central in East London, and she's also the co-chair of the National PCN Network at the NHS Confederation. She lives and works in Newham. She's been a GP principal at the Project Surgery for 18 years, as a list of 5,000 patients. And it's really great that Fazana's here. She's often in the news as well, kind of discussing COVID vaccination, all the excellent engagement efforts that she's doing and spearheading in East London. And she's also, you may have seen her image before, because she was one of the faces of the NHS that was the photographer by Rankin over the summer. So it's a real pleasure, Fazana, for you to come over and make time for Enfield today and share any learnings from East London that we most welcome. Thank you again for your time.
Thank you so much for having me, Riyadh, and thank you everybody, and good afternoon. I'm delighted to be here with nearly 200 of you, so thank you so much for joining us. So as Riyadh says, I'm a GP in Newham in East London, and we have a very diverse population like Enfield, as we have more than 200 languages spoken, and I did all my training as a GP in Newham as well, so I'm delighted to be in such a culturally diverse area. Apart from being a GP, I'm also a mum of 2 teenagers, and any parent on this call will know how much fun it is when they're 17 and 18, and anything you ask them, you just get a lecture about why they can't do it, like take the bin out. So when it came to my turn to have the vaccine, I was front of the queue, not just because I'm a GP and I'm a bit more at risk with having patient contact, but also because I'm a mum and I want to be well to look after my children. I'm also British Bangladeshi, so as Shahana said, I know that I have a much higher risk of getting sick with COVID. So in one of my roles nationally, I'm privileged to see all the great work that's happening with COVID vaccine delivery. Primary care networks are only just about a year and a half old. And what are primary care networks? Well, we're just a grouping of a number of GP practices. So I'm clinical director for 7 practices. We all work together in Newham, and we cover 67,000 of our residents. But the great thing about primary care networks is that we were designed to work with our communities. We were designed to work with our councils, with our hospitals, because you will know that when you go and see the GP can do so much for health, but we're only one part of the jigsaw. So I'm really delighted to be here today, to be speaking to you as part of the community, because we're not going to beat COVID unless we do it together. So we've seen some great work over the country, haven't we, from buses going to where you are in Surrey, to vaccine taxis. I'm fortunate that Newham is a borough of just a 4-mile radius, and we've got 7 sites. We're hosting the Nightingale Hospital at Excel, that's a mass vaccination site. We've got some community pharmacists, 2 sites. We're also seeing that there's good uptake when we do little pop-up clinics at mosques. But despite all that, although London has had a good uptake with the over 70s of 8 out of 10 people being vaccinated, nationally that's 9 out of 10. I'm seeing in Newham that we're still 7 out of 10 only, and this is the over 70s. Newham has 74% BAME, and that's made up of our beautifully rich, culturally diverse populations. So I wondered what we could do about that, because clearly what we're doing isn't quite working. We're doing some great stuff, but we need more help. And I think that help will come from listening. One of the things I was quite distressed about is hearing that up in Darwin, which is a place in Lancashire, Pakistani women are already trailing behind on the low uptake of COVID vaccination. And of course, as a woman, that's really important to me. It's great that we've got pop-up vaccination clinics in mosques, but not all women go to mosque. I don't go to a mosque regularly. There's no religious requirement for women to go to mosque. So how do we reach women? And as Shahana said a bit earlier, we all love our mums, but we're all a bit scared of our mums, aren't we? When your mum tells you to put your coat on, you put your coat on. If your mum tells you to get your jab, you'll get your jab. And I'd really like to hear a bit more about particularly the women who perhaps are living in extended family and who might be able to help not only themselves, but their mother-in-law, their father-in-law, their mothers, their fathers, their children, their sister-in-laws, their brother-in-laws, and their friends, because we all know that that's where the power lies. So I'd really like to see and listen to what we can do. And one of the things that I've started doing in my own practice, I run a small practice of 5,000 patients, because we've got quite a small number of over 70s, but quite a young population. I've actually called, and I'm in the process of calling all the people who have said no for their vaccination, who have told my admin staff that they don't want it. And so far, having done about 20 calls, it's really interesting that most people are not declining. They're not absolutely adamant that they don't want their vaccine. They're just not sure. So
you have 1 minute left.
Thank you. Lots of questions about if I've had COVID, the infection, as we saw earlier, 44% of London has. Do I still need the vaccine? Yes. So I guess my plea to you is, please come and ask us those questions. We're here to work with you as your primary care networks, as your council members, as your public health, your GPs, your practice nurses, your community pharmacists. We're here as part of your community. We're not going to judge you. My job isn't to make you have your vaccine, but it's to make sure that you know the facts, not the fiction, so that we can all look after each other. Thank you.
Thank you very much, Fazana. That's really helpful, and also it's very important to have the perspective of a mother as a woman, as a professional woman. I think it's really, sometimes it can get overlooked, and it mustn't do. So I'd really encourage kind of questions and answers on this kind of theme in the Q&A panel. I'm sure that will also be very, very helpful to look at the fact that one size does not necessarily always fit all. So it's really important to understand how we can reach communities, and we're doing some amazing work in Enfield. It's really helpful to have had this regional discussion with Shahan and Fazana. Thank you very much. So now I would like to bring to the presentation Dr. Masood Ahmed, who's the Chief Medical Officer at NHS Black Country and West Birmingham CCGs. Dr. Masood Ahmed is the Senior Clinical Leader of BAME Heritage. He's the Chief Medical Officer of the West Midlands area of CCG. He serves an area of about 1.5 million in the West Midlands. And as such, obviously, with such a big area and a remit, it's really important to factor on the safety and efficacy for the population that he serves. He holds very unique executive responsibility for primary care medicines management, patient and public engagement, clinical leadership, and includes the development of clinical policy. And he's committed to tackling health inequalities and is a champion for digital transformation. So Masood, it's a real pleasure to invite you to Enfield today, and yeah, really keen to understand the kind of concerns that communities have with regards to the vaccine, and be very helpful to see what your thoughts are and your insights. Thank you, Masood.
Thank you, Riyad, and thank you for inviting me to this gathering, if you like, of such esteemed panelists. I think what's really interesting about this webinar is we've heard so many different perspectives, and I think all of those kind of contribute to that wider picture of a very complex challenge. And so it's been fascinating, you know, listening to Bola and to Habib and Professor Fenton and so on, and others, because I think that's really what these events are about. It's about establishing trust, sharing knowledge from hopefully trusted sources, and actually being able to participate in this sort of exercise, so that the population we serve feel more comfortable about engaging with us and actually taking part in the vaccination program. Next slide, please. So I'm really going to focus on two key elements. One is safety, and the other is efficacy, and how effective the vaccine is. From a safety perspective, I think that's often one of the biggest concerns that comes to us from our communities, and especially when they hesitate. As Prasanna quite rightly said, not everyone is refusing. Sometimes it is that sort of wait and see attitude, and again, we must be aware of that, not judge our community. You know, it's such all you've gone through the last year is understandable. And so in terms of safety, one of the things I would say is that, you know, we've gone through, as a country, as the NHS, we've gone through a series of checks. And the MHRA is our regulatory body. And they've not taken any shortcuts. And I think that's really key to point out, because one of the questions we get is, well, how on earth did we get a vaccine available and start the program within a year? And really that's because this has been a global effort. And whereas normally vaccine production takes 6 to 10 years, it's because each stage is done in sequence. And so you will have one part of the process going on, then there'll be, you know, request for funding and approvals and so on, and then the next stage, and then testing, and phase 1, phase 2, phase 3. And the great thing is that globally, everyone has worked together in order to do these processes in parallel. And that's the reason we are where we are. And so that's the first thing I would say. There have been no shortcuts. It's just been really a result of everyone working together, understanding the challenge. And really, you know, we are at the point now where this weekend we hit 15 million vaccinations, which is an unbelievable achievement. You know, had we been discussing this a year ago, not many of us would have thought it's possible. And that's because collectively everyone has really worked together. And actually, when you take into account that 15 million vaccinations have been given, the key thing here is we've not had any serious side effects. So again, when we talk about safety, the worry is that, you know, and some of the misinformation that's gone round is about, oh, well, actually, it's safer to have COVID than it is to have the vaccine. And that's simply not true. You know, if we take one of the bits of information that went round, it was that, you know, over 99% of people will recover from COVID. Whereas if you take the vaccine, that you know, that won't happen. Well, in simple mathematical terms, we know that that's not true. You know, 100,000 people have already died. 100,000 people. Now, if that 100,000 was the 1%, well, we would have a population of 100 million, and we don't. So again, it's you know, it's at 99.9%, etc., etc. Those figures don't add up. The other thing is that in terms of protection, it's not as simple as getting COVID and recovering.
You've got 1 minute left.
A lot in terms of long COVID and the impact of that. The other thing that we're seeing is that from a protection perspective, if you go into the hospitals, so many of the patients in critical care are actually you know, of a BAME background. They look like you and me. And that's really worrying. So as we protect our older cohorts, actually we are seeing the younger ones get admitted. And so it's really important now that we have, if you like, a gold standard of protection, that we take part and we kind of utilize that option. Next slide, please. In terms of some of the questions, you know, questions get asked, well, if I've had the first dose, do I need the second? If I've had COVID in the past, do I need any vaccination? And this is an emerging picture. From what we know at the moment, we aren't sure of how long you are protected for if you've had an infection. What we do know, though, is with vaccines, they prime the body. And so it's a bit like supercharging that protection. So when you have the first dose, you have a level of protection that will protect most of us from developing a serious disease. And it's that serious condition that gets you admitted to hospital. So in terms of the strategy is simply to protect as many people as quickly as possible. And that's to prevent death. In terms of the second dose, that really is to give you that boost in terms of long-term protection. Now, if you were to ask me, do we know how long that protection will last? Well, the truth is we don't. And so I think Professor Fenton sort of touched upon it, that actually in the future, we may be going through annual cycles of vaccination, similar to what we do with flu. But in terms of safety and efficacy, the vaccines that we have are actually more effective than the flu vaccine. The difference, though, is that, you know, COVID has a far greater impact on health than flu does. And that's why it's key that we protect ourselves. Next slide, please. Again, a number of speakers have talked about us being culturally competent. And I do like the fact that we're talking about competency rather than sensitivity. Sensitivity is almost like, well, we have to be careful what we say. And actually, that's not what our communities want or what they need. We have such a rich tapestry of diversity within our society, within our communities. And actually, that's what makes us who we are. And so it's important that any messaging and any communication and engagement we have is competent. It has to do the job that it was intended to do. That's what we expect for all other groups of our society. And therefore, that's what we should expect for our most vulnerable. And that's really key here, because actually the groups that we're talking about, they're vulnerable. And therefore, as healthcare leaders, we have a duty to protect them. And so it's really incumbent upon us to ensure that when we are having these discussions, when we are sending out the messaging, when we're sharing material, that we do that in different formats. And so the example on the screen is simply the same messaging that you would get in English, but it's in Polish. And certainly what we've done is we've done that in Polish, in Romanian, in Turkish, in Arabic, in Urdu, in Punjabi. And that's the recognition, you know, Farzana said herself that, you know, it was, I think, 200 languages in Newham. Well, the key is that if we are to overcome the hesitancy that we have within our communities, then we have to be able to talk to people in the format that is most comfortable for them. And part of that is language. Part of that is actually the channels within which we approach them. Next slide, please. I'm going to sort of touch upon some of the common questions that perhaps aren't always addressed in a webinar, just really to kind of feedback some of the things that we've been asked that perhaps we hadn't thought about at the beginning of the program. So I've talked about sort of safety. In terms of side effects, one of the things is, you know, what will happen? Well, I know that there are some side effects, but those side effects are often mild. A sore arm, a bit of a fever. I know when I had my vaccination, I was in bed for a day. One of the questions that is often asked that, oh, the side effects are significant and serious, and you may not be able to work, and so on. Well, if you were to use the classification that I've just given, actually, I wasn't able to work for that day because I was tired and I felt, you know, a bit exhausted and so on. So it fits into that category, but that doesn't necessarily mean it's serious. and most of us will recover within a day or two. But it's important to recognize how we categorize side effects, and we don't, if you like, overemphasize the impact. In terms of getting your vaccine, is it safe? People sometimes worry about, you know, the setups that we have in terms of our local vaccination sites and others. And as Farzana said, you know, as Shahana said, you know, if her mother was happy about going through the process and felt that it was well organized, then that's key. And so really, you know, having visited some of our vaccination sites, it's one of the things we're very aware of, to make sure that we have the right pathway so people can follow that, they're kept socially distanced. One of the things is to ensure that people aren't queuing up for too long. So one of the things we often say is, look, please, when you have an appointment, don't turn up more than 5 minutes beforehand. So these are practical implications to be aware of. And I've touched upon, you know, the level of protection, why it's important to get your vaccination, even if you've had COVID in the past. Because again, it's protecting not only yourself, it's protecting those around you, and it's protecting the NHS. And lastly, one of the questions is, how long does it take to become effective? Well, actually, the way in which the vaccine works is that it provides a stimulus for our own bodies to produce the memory cells, which are then primed and ready for when you have a proper infection. But that can take a few weeks to really kick in. And so it's important to realize that just because you've had the vaccine doesn't mean you can suddenly go about your normal activities and you're immune. One, it takes a few weeks to get that protection, but also we're still understanding how it impacts transmission. And so the likelihood is, even once we're vaccinated, we do need to keep in mind that we have to follow good practice of washing our hands, wearing masks, and keeping socially distanced. I'm going to stop there now, because I think the real opportunity is in the Q&A. So thank you.
Thank you, Masood. That's really helpful, really reassuring that it's safe and effective. A lot of context there, a lot of information, and I'm sure we'll capture, and we'll come back to this in the Q&A. So moving swiftly on to Dr. Fahim Chowdhury. He's Enfield Primary Care GP Clinical Lead for the Enfield Directorate of the NCL-CCG, and he's going to provide a quick COVID vaccination update in Enfield. Thank you, Fahim.
Good afternoon. My name is Fahim Chowdhury, and as Riyad said, I'm a local GP, and I'm a proper homegrown GP. I grew up in Enfield, and I attended a local comprehensive school and college. And my journey as a doctor started in Enfield, where my first day starting medical school, I went to the 8th floor Enfield Civic Centre to pick up my grant check. These are the good old days where there were no student loans and we used to get grants. I can say I'm very humbled and honoured to be working in Enfield, especially during these difficult times where everybody involved in the care and well-being of our residents got together and managed to very swiftly start up the vaccination for all our residents. Can I have the next slide, please? So I can say currently at the moment, 50,000 of our residents have been vaccinated. 80% of our first 4 vulnerable groups have been vaccinated. So we have done really well in Enfield. Of our 5 boroughs for NCL, we have the highest BAME vaccination. We still have a long way to go, but we've done really, really well, and I'm quite honoured and humbled by this. At the moment, we have 9 sites that are doing the vaccinations. The first to start up were the 3 GP sites, one at Evergreen in Edmonton, Carlton House in Enfield, and Winchmore Hill Practice. We have 2 mass sites, the Dugdale Centre in Enfield and the Spurs Stadium in Tottenham, which serves both Haringey and Enfield. And we've also got 4 pharmacies that cropped up that are providing vaccinations for our Enfield residents. My mum, who is 74 years old, was vaccinated by her local pharmacy, and it has been really, really efficient. So really great effort in Enfield by everybody who's involved in the care of our residents. Next slide, please. So all the GP practices who work as a federation have collaborated together to coordinate the vaccinations. We first started using the Pfizer vaccine, which is the vaccine that came out first. A very challenging effort because we needed the vaccines to be at -70 degrees and to be delivered centrally. We are now obviously delivering the Oxford vaccine, and it's made it easier for the mass vaccination sites and the pharmacies to deliver this. So we've most up to date now is over 80% of our most vulnerable groups have been vaccinated. We are still increasing our efforts to vaccinate our most vulnerable groups. We have done our first dose vaccinations to our care homes. We are still mopping up all the care home residents who haven't had their first vaccines, and we're now approaching our second vaccination to provide maximum protection. Our care partners, BEH, the Barnet and Enfield Healthcare Group, are continuing to work with their teams to ensure maximum uptake in our most vulnerable groups. We are on track to complete our vaccination of all our housebound patients who are very, very vulnerable by the end of February. Next slide, please. Okay,
that's great. Well, thank you very much, Fahim, for that. We're making great progress in Enfield, and thank you for that summary. It's really, really helpful. Yeah, so now I'd like to hand over to Paul Riddell. Paul is Vice Chair of the Enfield Caribbean Association. Paul, as you might see from the kind of the flyers and the publicity surrounding this this event, very kindly gave permission to use his image of him being vaccinated at Evergreen recently. I know he's very committed to community engagement, and is a very valued member of the panel, and coming in today to discuss his kind of patient journey, as I could say, in terms of vaccination. So Paul, over to you, good self. Thank you.
Thank you, Riyadh. Hope everybody can hear me. Good afternoon, everyone. Thank you, Riyadh, again for the opportunity just to say a few words. Obviously, I'll have to be very brief because I'm aware that you're running quite late. It's an interesting thing when you asked me to talk about my journey, because I wanted to kind of start it off at the very beginning, because it's a journey that we've all shared. I've been speaking to family in the States, I've been speaking to family in Jamaica, and we're always talking about COVID. This is a serious worldwide pandemic. But as I say, the journey for me began like everybody else, didn't it? You know, we all sat in front of our television, hearing about this virus in Wuhan in China, and naively thinking that it will never get to the UK. Sadly, it appears that the government thought that as well, I think. Anyway, it got to us in March, and March was actually quite a defining month for me because I actually fell ill in March. And if there's 181 people watching. I don't know if anybody got ill in March, but at that time, you couldn't really have a test, really, unless you were really serious and you went to the hospital. Spoke to my doctor. My doctor said to me, "It sounds like you may have it, Paul. I think you should self-isolate." And kids are no longer here, so I was able to self-isolate in the back bedroom with the most horrible temperature and a dreadful, dreadful cough. The temperature was so bad that I found myself sometimes changing at least twice a night. It finally subsided, although the cough stayed around for a while, and finally the cough stopped, and I thought I'm getting back to normal. And then I started getting these odd symptoms. You know, so one day I was like really, really hot. I thought I'm going to get a temperature. When I took my temperature was normal. I'd take it like an hour at a time each day, and it was just completely normal. I couldn't understand what's going on. Another day I could be cold, particularly from my knee downwards. And other times, which was quite scary, and I'm still getting it, is I would just get this tingling all through my body. So in the last few months, I've been to an hematologist, very extensive test, couldn't find a thing. And I'm now seeing a neurologist and doing all sorts of MRI scans on my spine and my head and all sorts of things. They think it's my nerves, nerve damage, but there's still more tests that they have to do. So I wanted to tell people that because obviously it explains one of the reasons why, like somebody of the speakers, I couldn't wait to get the vaccine. Anyway, in terms of the vaccine, it was kind of quite strange, really. I was sitting down on a Friday evening when I got a text, and I looked at it, my GP, and I put it down. I looked at it again, and I thought, is this an Oaks? Anyway, thankfully I went on there, and by the following Monday, I went to Evergreen and had my vaccine, which is great. It was well organized, and no complaints really. Prior to that, I had the advantage. My sister, one of my elder sisters, actually is a pharmacist, so she was able to reassure me. And my son Marcus, who works in NHS, as you see earlier on, he was also able to kind of assure me. But I probably didn't really need it that much because I don't want to be ill like that ever again. So I didn't have any problems in terms of taking the vaccine. I think the thing for me, though, you know, kind of thinking about it and moving forward, was that I'm a very solution-oriented person. I like solutions to problem. I wasn't one of those people that was concerned about how quick it took to get to the point about there was a vaccine. I understand some of the questions about how people felt. Why was it done so quickly? How many Black people had clinical trials? The main thing for me is that we had an international crisis and people found a solution, and that solution was the vaccine. So I didn't have any problems in actually going to take it. The other thing for me was it was a family thing. You know, I've got 2 kids and I've got some wonderful grandkids, and I haven't been able to see them really very much. So that was a problem for me. I want to get back my family life. I want to see my kids again. I want to see my grandkids again. And my friends. I have a good group of friends that I haven't seen or visited in nearly a year. And I have a wonderful mother who's now 93 years of age in Jamaica, who I speak to all the time. And I can't get on a plane to go and see my mother. I can't tell you how frustrating that is for somebody. And I normally go every year to see her. So that's one of the first things I'm going to do. Once everything is opened back up, I'm going to book that flight and get on that plane to go and see my mother. So I think for me...
You've got 1 minute left.
Yeah, I would say thank you, Louise. I think to people who have any concerns, talk to people like myself, talk to people in the wider community who have had the vaccine, go online, not so much social media, but go online and do your kind of own research about what's going on. As Masood was saying, the speaker before me, there hasn't been nobody has died, there hasn't been any serious effects. After I had mine, my arm was sore for a day, and that was it. So I would encourage all of you, when you get the invitation to go, book it and turn up and have your vaccine. It's the best thing that you can do to safeguard yourself, your family, and people in your community. Thank you.
Well, thank you very much. Thanks for your time. That's a real impassioned plea, and thank you for giving us that kind of family perspective. It's really, really important. Thank you again for that. So we're going to move swiftly on to our Q&A session. It'll be the same speakers, national, regional, local. In addition, we have Emily joining us, who's the head of physical health and COVID-19 testing at BEH. So she's working and coordinating the efforts with the PCNs regarding housebound and care homes. So we'll kind of move swiftly on. And the chair is Hetal Shah. Dr. Hetal Shah is a GP, and he's also ICP and Medicines Management Clinical Lead for us in Enfield for the NHS. So yeah, really delighted for Hetal to chair this segment as well. So Hetal, over to yourself, and Dudu, who's been looking at all the questions with Katie over the last hour or so. Thank you all for your patience, and I hope this Q&A session will be quite helpful.
Thank you, Riyadh, and thank you everyone who's here. There's over sort of 200 people, I think, when we got to our peak in terms of participants, and all our panelists as well. And Riyadh, Dudu, and everyone who's been involved in putting this together. It's been a lot of work. I'm also an Enfield resident, but also I was born in North Middlesex Hospital. Went to school here local, and apart from going away to do my sort of training as a doctor, I came back, and I'm proud to be a GP here locally. I was working until end of March last year in the east of the borough at Evergreen Surgery and Boundary Court Surgery, and I was also proud to represent the southeast, which is the Edmonton area, as a governing body member at the Enfield CCG until we merged as NCL. And I'm here really as I'm a GP at the moment. I'm a GP at Winchboy Hill Surgery, which is a COVID vaccination centre. But I'm really here as the Integrated Care Partnership Lead, which is a fantastic role really in terms of since August. I think the position has been there, which has been something new really, where we've tried to bring together lots of stakeholders together, people who work together but not really in the same in this sort of way. It's bringing together the health service of the NHS, GP surgeries, hospitals, commissioners, community services, pharmacists as well as local authority, public health, and the list goes on. Social care, community services, voluntary sector, and the list goes on. And we're working very closely together. And we started the aim was really to try and help bridge the gaps that we've been hearing about this afternoon, not just with COVID, but inequities in terms of uptake of immunisations, smears, the list goes on. And really, we've been quite active in having a very good dialogue and engagement with our communities, with the flu campaign, which is still running, but really was the focus until about January time, where the COVID vaccination's been our focus. And that's what's bringing us together here today. And it's been fantastic to hear from such a great lineup of speakers, really, to give their perspective from their different areas of specialism, to hear about this very safe and effective vaccination, which is really the key to trying to bring us back to some sense of normality. We all, I'm sure, craving life pre-March last year. And I think this is really our ticket back to that place. So I don't want to talk any further, because I really want to give this platform to you now, having listened so patiently, and we will do our best to try and answer your questions as honestly as we can. Except for the last thing I want to say is that really I'm hoping that this will be a platform for us to discuss other areas, as I alluded to earlier, about immunisations and smears and that sort of thing, which really we want to talk about to try and help sort of myth bust and help sort of improve the uptake, especially in our BME groups and other areas of deprivation. So yeah, I open the floor. Dudu, do you mind fielding this the Q&A bit, please?
Yes, of course. Thanks, Hettel. So I'm going to be taking some of the key questions out of the chat. I hope you'll find that useful. So the first one is around vaccine safety. And Masood, I'm wondering whether you could lead on this, and then others on the panel can contribute as well. There's been a number of questions around vaccine safety. How do we monitor adverse effects? And is the vaccine safe for people who've got underlying conditions such as anaphylaxis, sickle cell, cancer, allergies in general?
Dudu, I apologize. My Zoom just froze, so all I got was allergies in general. So hopefully I'm answering your question. If I'm not, please let me know. In terms of allergies in general, what we do know is that with the Pfizer vaccine, if you suffer from serious allergies, when I say serious, I mean, do you carry an EpiPen around? So those people that kind of carry an EpiPen that has adrenaline in it, they should actually avoid the Pfizer vaccine and go for the AstraZeneca. But in terms of normal allergies, actually both vaccines have been shown to be safe and effective. I hope that answers the question. Apologies, it did freeze.
Thank you, Hettel. I don't know whether you want to follow up on that.
I'll pick up the bits. I mean, in terms of the question about patients who are otherwise vulnerable or having chemotherapy and that sort of group of patients, absolutely, you're actually the priority group of patients. You're the people who are most vulnerable if you're to catch this awful disease. And so, what we really want is to protect you first. So absolutely. There's not a medical condition, sickle cell. I think that was one of the conditions you mentioned, which patients in these groups should not be avoiding the vaccination. So if that's what people are thinking, then please, I'm saying this loud and clearly. Please get your vaccination as soon as possible. Thank you.
Great. And how are adverse effects monitored? Do you want to take that one as well, Hettel?
Yeah, so the vast majority of patients don't have any effects beyond sort of sore arm, bit of muscle ache, and a headache. When we're jabbing, certainly at my surgery, when we're giving the vaccination, it depends on which vaccination you're having. The guidelines have changed a bit, but patients having the Pfizer vaccination are monitored for 15 minutes just to make sure there's no serious adverse effect. With the AstraZeneca vaccination, if you're driving, we ask that you don't drive for 15 minutes. But actually, we've done over 10,000 vaccinations at our site, and we've had no serious adverse effects. And I know that's been the case across all the other sites in Enfield and beyond. So, there's no major side effects that we've noticed.
Great, thank you. And just to add a little bit of information for people's knowledge about adverse effects, there is also a national programme for monitoring adverse effects from medicines and vaccines that will also be used for COVID vaccine as well. Okay, just moving swiftly on, we've had a number of questions about whether the vaccine has an effect on fertility. Fazana, would you like to answer that one? Thank you.
I'd love to, thank you. So I've had this question asked many times, and understandably lots of women are concerned about that. I can absolutely 100% guarantee there is no negative effect on fertility. It does not affect your ability to have children now or later at all. Okay, because I know that's a big concern for a lot of women. It doesn't, there is no evidence that it affects your fertility at all.
Thank you. Masood.
Just to add to that, part of the reason is because vaccines don't work in that way. So actually all the vaccines that we have don't have an impact on fertility. And therefore it's important to understand that this vaccine is no different to others that we've had in the past.
Great, that's really helpful, thank you. So the next question is, does the vaccine stop transmission? Nitika, would you like to answer that one?
Yeah, sure. So currently the early research that is coming out is starting to show that having the vaccine does help prevent some forms of transmission. Obviously, the best way of preventing transmission is to continue with the social distancing, wearing of masks, washing hands at all points. But having the vaccine is starting to show that it will help to prevent transmission, as well as decreasing the severity of the illness if you were to catch it.
Thank you, Nitika. So the next one is around the second jab. There's been a few questions around this. Will there be enough jabs for everybody to have a second dose? Is it okay that people will be waiting up to 12 weeks for their second jab? And will the second jab be of the same sort of vaccine as the first one that they've received? Fahim, do you want to answer that one, please?
Sorry, Dudu, sorry, I missed that. Can you just repeat the question again?
Yes, of course. So it's about the second dose. The question is, will there be enough for everybody to get a second dose? And is it okay that people are waiting up to 12 weeks for their second dose? And also, will the second dose be of the same type of vaccine as the first dose?
Okay, so with current evidence, it's been shown that the effects of the vaccine goes well beyond the recommended 3 weeks. So after you've had your first jab, it takes about 2 to 3 weeks to build up some immunity. And the JCVI have done a study to show that it can go well beyond 3 weeks, and the effectiveness is quite high. And it's been recommended to have the jab up until 3 months after you've had your first jab. They are looking into whether you can mix the jabs at the moment. So if you've had your Pfizer jab, they're looking into mixing that, but I don't know what the latest update on that is. We do know that they have got enough jabs because when they first did their modeling is to have 2 jabs. The reason why they changed that was because they wanted to get maximum protection as quick as possible. And that's where they changed the way the jabs are given, and the length they've increased from giving the first jab to the second jab. Because they changed that, we managed to get 15 million people vaccinated very quickly up until the 15th of February. I do suspect that there is going to be enough jabs to go around. I think the main issue is manufacturing and supply. But the latest update is that we haven't had any issues unless someone can tell me if there's been any changes. But from what I understand from our daily conversations is that there has been no issues in terms of supplying the vaccines.
Brilliant, thank you. So the next one on the list is, should somebody have the vaccine if they've already had COVID? Masood, I think that you addressed that in your presentation.
Yes.
That they should.
Yeah, so even if you've had COVID before, you should wait. So from a positive test or from having COVID, you should wait a month, and then actually you should go ahead and get vaccinated.
Great, thank you. Nitika, I think the next one is for you. What measures are being taken to encourage people from Black, Asian and minority ethnic communities to have the vaccine?
Thanks, Dudu. So this webinar is the first in a series that we in Enfield from the Integrated Care Partnership, comprising of the Council, the CCG, our provider partners, are hoping to start by engaging with our communities. Both Marcus and Professor Fenton earlier talked about building trust with our communities, and we are hoping that this is the start in Enfield of building that trust, building those relationships, and engaging with our communities. I think Bola as well may have something to contribute on that.
Yes, great.
Thank you. Yes, absolutely. Just to echo that by saying that Professor Whitty hosted myself and a group of senior leaders from the Black and Asian and ethnic minority community a couple of days ago. Very well attended. We had well over 100 representatives representing different groups and networks. And I think the fact that, the chief medical officer took the time to spend 2.5 hours with us, really focusing on how we do improve the uptake within our communities, for me is a very powerful signal of the commitment at the very highest levels to ensuring that our communities are safe, by supporting them to have all of the information that they need to be reassured to come forward for the vaccine. Thank you.
Great, thank you, Bola and Nitika. Okay, so the next one is, should people who have been shielding but have now had the vaccine continue to shield? Does anybody want to volunteer for that one? Yes, go ahead, Masood. Thank you.
Yes, absolutely. So again, you know, the more people get vaccinated, as we see community rates go down, there will be a point in time where we will have that sort of, you know, ability to go outdoors and meet with others. But in the meantime, it's important to protect yourself and shield. And again, I think, you know, building on what everyone else has said, all the actions that we're taking reduce the risk. So there's nothing we do gives 100% protection, other than shielding, I suppose, because then you're not exposed. But really, whether we wear masks, whether we wash hands, whether we get vaccinated, they all have a significant contribution in terms of reducing that risk.
Great, thank you. Emily, we've had a number of questions as well around the housebound residents. So I just wondered if you could explain to participants how housebound residents will be receiving their vaccine.
Yes, thank you, Dudu, and thank you for having me on the panel. We are currently working with our GP colleagues across Enfield to ensure we have all the lists of those who are housebound, so we can go out and vaccinate them. Those lists are coming through to Barnet, Enfield and Harrogate Mental Health Trust and our Enfield Community Services Division. We'll be making contact via telephone up to 4 days in advance to make sure that we're coming round and we're vaccinating yourself, and we will also vaccinate your carer at the same time. We realise it's a really anxious thing for people to be waiting. We should be done by the end of February. That's our aim, to have everybody completed by then. So we do ask people to be a little bit patient, but if they're anxious, to get in contact with your GPs and they'll be able to forward on information to us to make sure nobody is missed.
Thank you, Emily. Masood.
So just to add to that, the latest advice is that anyone over 70 who hasn't heard, or perhaps was waiting and had a bit of hesitation but wants the vaccine, please get in touch with us, either through the national booking system or through your local GP. But again, previously the advice was wait to be called or invited. Now, especially if you're over 70, you can make that call. But again, I mean, this has been a huge logistical challenge to ensure that no one gets left behind. But as Emily said, that really is the objective, to make sure that no one is left behind. So if for any reason you think you've been missed, get in touch.
Thank you, Masood. So can you just clarify for attendees whether that's the same message for the under 70s?
Not at the moment. So
Yeah.
in terms of the under 70s group, so we've now moved to cohort 6, which is a much bigger cohort. And certainly if you were to contact your GP, they would be overwhelmed. So please,
Yes.
if you're in those groups, do wait. It is just directed at the over 70s, but keep an eye out, because again, with a program that is this big, there are regular updates in terms of what's happening.
Great, thank you for that. We've also had a question come through about vaccination for people who've got a learning disability or who are living sort of independently or semi-independently with a learning disability. Who would like to answer that question, please? Emily, thank you.
Yes, I'm actually really excited to be able to answer this question, because it's something quite passionate to myself. Working as part of a mental health trust, we are very keen to make sure those with the learning disabilities, autism and SMI are captured and vaccinated.
Emily, sorry to interrupt you. Can you just explain SMI, please?
Oh yes, apologies. So for those who have serious mental illness,
thanks.
What we will be doing, we've had a number of teams going out to learning disability and supported living and being captured there and being vaccinated in their own accommodation. But in Enfield, we're also working very closely with our council colleagues and the integrated learning disability teams to ensure that we have a hospital hub site in Enfield that would allow patients to come and be vaccinated there in a site where you have longer for your vaccination. It's got sensory equipment in there, lights, things to keep patients calm and to feel comfortable, and it is manned by learning disability and mental health nurses who will be able to vaccinate and use their skills to make sure it's as calm and easy for people as possible. We will be getting in contact with all of these patients and booking them in through our system as well.
Fantastic, thank you, Emily. And do you have a time scale for that piece of work?
We open the clinic on Monday.
Brilliant.
So we're working very hard to get patients in and ready, and we will be ready to go Monday onwards.
That's excellent, thank you. And Emily, I think that this next one is also for you, about vaccination for carers.
Yes, thank you. We have also been vaccinating care home staff as we've gone around with our PCN colleagues through into care homes. We've been vaccinating carers, those with housebound. So if you are a carer for a housebound patient, we will vaccinate you along the same time that we're doing the housebound patients. Also, carers that are coming in with those into the clinic for learning disabilities will be vaccinated at the same time as the patient, as well as a number of hospital hub sites and mass sites across Enfield and across North Central London that have been opened up for all carers to be able to have access for the vaccinations as well.
Thank you. And can you just explain whether somebody needs to be registered as a carer to receive the vaccination?
Originally, that was part of the guidance for those who were paid or registered carers. However, that is now relaxed. And I think the message is we want to vaccinate as many people as possible. And if you are looking after someone, then we will vaccinate you.
Great, thank you. So we've had another question through. Can people protect themselves through improved diet, using dietary supplements? And shouldn't we be promoting healthy lifestyles? Riddell and Nitika and Fahim, I wonder if you could take that one, please.
Yeah, I mean, certainly what we know is that if patients, for example, are overweight, or if they have uncontrolled diabetes, or if they have diabetes, or if they have a high blood pressure, or any of these sort of medical problems or chronic medical problems, they're more likely to get COVID and also have poorer outcomes if they were unlucky to get COVID. So certainly anything that you're doing which helps to improve on these conditions or prevent you getting these conditions will be of use. So exercising, healthy diet, absolutely all of these things will be helpful. The only thing I would say is that I'm aware of sort of WhatsApp forwards and things about certain sort of fad type diets and things that can sometimes help. I would probably advise against those. Rather than just keep to the sort of clear messaging about healthy lifestyle. So it's not specific foods that you're eating or cutting out, that sort of thing. Not sort of faddish in nature, more sort of promoting the normal message that we do about healthy lifestyles.
Thanks, Riddell. Fahim.
Yeah, hi. As with any foundation in primary care, a healthy lifestyle is essential for all health outcomes. So, we are always promoting healthy lifestyles, healthy diets, because that will improve health across the board for a whole host of illnesses and well-being. So, yeah, everybody should be promoting healthy diet, healthy lifestyles, irrespective of COVID. But as Riddell said, the outcome for people who are with lifestyle-related diseases such as diabetes and heart disease have a worse outcome than the rest of the population. So it's a very good question that reminds us that we do need to lead a very, very healthy lifestyle.
Great, thank you. But just to add to that, whilst it is obviously very important to have healthy lifestyle, we can't use diet and supplements in a kind of instead of a vaccine.
Thanks, Dudu. I was just about to say the same point, is that whilst all of these healthy lifestyle measures are important, the only documented proven defense against coronavirus infection at this moment in time is the coronavirus vaccination. Everything else should be done in conjunction with this.
Great, thank you. And I think we've got maybe time for one last question, and that will be just to say that we've had a number of questions that we probably won't get time for. We will include them in our after event, post event document that we'll be putting together. If people are interested in having that, which will include the slides, then Riyadh, is that okay if we put your email for that?
Yes, that's fine. That's great. Thank you.
So you'll have Riyadh's email on the invitation. It's riyadh.karim@nhs.net. The last question is, do we have any stats about the effect on of COVID on the Somali population and vaccine uptake in the Somali population in Enfield? Hetal, would you like to answer that one?
I think that's a very specific question. I wouldn't have that sort of at the tip of my fingers. So I think that's probably one that we can get back to whoever asked the question,
yeah.
unless someone does happen to have that.
Okay, Fahim, and then
the last evidence that I received about the Somali population is that they are very disproportionately affected. So there's a very high proportion of death from COVID for the susceptible Somali population. So they are very high risk. In terms of the uptake, I don't know what it is, but I do know we've got a large cohort of Somali patients where I work, and they are very, very vulnerable, unfortunately. So it's even more imperative that they get vaccinated.
Yeah, absolutely, great. And we will have a Somali event that we'll be promoting shortly as well. Masood.
Just to add that, I mean, this goes back to what Bola was saying about having data that has actionable insights. And so that data is building up as we go along.
Yes.
So while we may not have it at hand, we will have it moving forward. And so understanding how our BAME communities are, what that means, you know, and not just lumping them all together. They are all different, they are all unique, and we have to recognize the variation in terms of behaviors and uptake and impact for all of those. So I think it's an emerging picture.
Absolutely. Okay, so I think that's the end of the question and answer section. I'm going to hand over to Nitika now, who's going to sum up our session today. Thank you to all the panelists for the fantastic answers.
Thanks, Dudu, and thanks to our gallery of experts for contributing today. As we draw the seminar to a close, I would like to continue that thanks to all of our speakers for their fantastic contribution to the Enfield discussion today. I'm very grateful for your time and effort in coming forward and supporting us. Mainly, however, I'd like to thank our Enfield audience for the full and frank discussion they prompted via their question and answers. And I really do feel that our learning journey together is only just beginning today. We planned this event in recognition of the anxiety and the hesitancy that we've seen in some of our residents towards the vaccine. And I hope our aim today was to provide you and those residents who had hesitation with both accurate and trustworthy information so that you feel better enabled to make a more informed choice. We hope this event has begun to achieve that aim, and like I've just said, it is the start of a journey together. One of the most important points to have come out of this seminar today is the recognition that vaccine uptake is a symptom of wider societal issues and inequalities. So I feel it's vital that our next steps harness the energy and the enthusiasm shown here today so that we can continue to work together to overcome these issues. We've begun to tease out some of those issues holding us back, but the Integrated Care Partnership would like to present a local offer to all of our community groups. And with that in mind, we have a very quick question we'd like you to answer on our evaluation poll. If we could pop that up. I'll just give you a few seconds just to answer that. So thank you for participating in the poll. We will work upon those results. Hopefully we will be able to get some update, there we go, coming out live with some results. Once again, on behalf of the ICP, Enfield Council and North Central London CCG's Enfield Borough Directorate, I'd like to thank you all for attending. I'd also like to remind everyone that today's event was recorded and hopefully we'll be able to share the link to the recording once it's ready to share. And as Dudu has already said, if anybody wishes to receive the slides, please email riyadh.kareem@nhs.net. And I hope you all have a very good afternoon. Thank you.